Rhino, we had the national anthem going on, and we've got Commissioner Mike Chaney with us. He, of course, is the commissioner of the Mississippi Insurance Department. So we did our duty. We stood. We put our right hand over our heart for the national anthem. Patriotic folks here. Commissioner, good to see you. Thanks for coming on.
Thank you. Good patriotic. You know, that Star Spangled Banner ended just right, Gerard.
It was perfect, wasn't it?
Perfect. Great.
we were fortunate on that respect. So, what about it? Have you spoken today?
I spoke at 10:10. It's evident you didn't listen to me.
Well, I can't. I'm on the show. I got a headset on.
Hey, for the folks listening out there, Gerard and I know each other. And
that's right.
We'll spar a good bit. And,
that's exactly right.
Our philosophies are pretty close. So that's all right.
Oh, my gosh. So, what was your message today?
My message was you need steady, predictable regulation.
Okay.
You've got a market that you got to have a lot of adaptation in, and you got to adapt when you can. It's an ever-moving market. It changes on a daily basis because of the world conflicts and things that we do. Now, the average person out here at the fair is not interested in reinsurance until it's a pocketbook. But basically, I talked about the strength of Mississippi homes, which, I'm not real happy about the fact the legislature took my authority to spend the money away. Now, we did have a little thing in the bills that sends the money to trust, so evidently we may get it back in January. But the problem is it takes so much money to get the program started back up. We wasted a lot of money. But outside of that, we talked about the good news is we got a steady stream of money for rural fire trucks, an additional $18 million starting in 2007, and that's not tax dollars. That's dollars from non-admitted fees, the insurance companies. And that's the way it should be. It shouldn't be tax dollars going to it.
Okay, gotcha. So something, Commissioner, I know you're paying attention to. I would argue that the general public probably isn't, because, when you get into health insurance, it's so dang complicated. It's an incredibly convoluted ecosystem. But the Biden administration, in the Inflation Reduction Act, increased the subsidies in the ACA marketplaces, the exchanges, and we saw enrollment across the country, but in Mississippi, it increased substantially as a result of lowering the cost. Those are scheduled to expire at the end of the year, and right now, that was not included in the budget bill. Right now, it doesn't look like there's an appetite in Congress to extend them.
Well, you're right, Gerard. There is no appetite. I will be at the NAIC, that's National Association of Insurance Commissioners, in Minneapolis on the 11th of August, and that's a big topic for us. Bob Williams in my office and David and I will meet with SASAL. We've got an hour set aside to see what we need to do in Mississippi. But when the enrollment spiked, it went from about 120,000 to 300,000.
I think 370 is the last figure I saw.
KFF. We're not sure all of them.
More than doubled.
And what we see with the rate filings we got 2 weeks ago, so you're kind of privy to some of that.
Yeah.
We're looking at rate increases requests. Now, I'm not saying we're going to approve them, but the feds may intervene on us. But we got requests up to 58% increase. And the problem you have, and that's on non-ACA products, Affordable Care Act products. The problem you'll see is we'll probably dump 300,000 people in the uninsured market. But we got a game plan now.
Okay.
And the game plan is we kept our high-risk pool alive. And I met with a group yesterday in the office about formulating some plans. We'll have to put together a think group, somebody like you that's been around and that can figure out how we can provide insurance through the high-risk pool that's affordable now.
Okay.
You'd be looking at a policy of about $500 a month.
Okay.
Because those policies are going to over 1,000 now. That didn't include family.
It's
if you got a family policy, you're looking at $2,500 a month. And you can't do that and pay your bills and pay your automobile, your homeowner insurance, and buy groceries unless you are wealthy like some people I know.
And we should be clear, this isn't a problem that's unique to the state of Mississippi. The insurers across the country are advising the states that, look, we're going up. And most of them cite increased medical cost as the driver here. It is,
and I worry about what will happen with the hospitals. We got 9 hospitals or 10 that on a bubble about going under. It's not just the Delta. You got one in Meridian that's in trouble, and Greenwood's in trouble. It's not a secret.
Right.
And you got a desert between Greenville, Mississippi, and Vicksburg. The hospital there has not been rebuilt, and what we're using there is an emergency medical clinic for medical care. And we're trying to work with the medical folks. And why I'm involved in it is the federal government will not allow us to sell health insurance if you don't have a network.
Right. Yeah, well,
and you got to have a network.
You got to have a network, and that, of course, that's always the big hurdle for anyone that wants to sell insurance in the state. It's not that they can't get through your office and the regulatory requirements. It's that it takes a lot of time and money and effort to build a network.
It's tough to do, and we'll work on that.
Okay.
Hopefully we'll get all of that put together.
Okay.
So.
Well, I just know that's on your table, and it's something you guys are thinking about. That there's the forecasts are from the industry analysts that we could see a substantial drop-off from those enrolled in exchange plans. And there's some additional requirements now you got to meet also to qualify for the subsidies, and that could cause a drop-off, which means we have more uninsured, and that becomes, as you know, an additional cost to the hospitals.
It's going to be a nightmare for us. And, you know, you and I had a private conversation, and I will say we've had to do research on what's going to happen on the drug side. I know I'm on the board at the State Health Plan, and we get requests all the time for a drug that costs $1 million a year. We got a request for one that costs $3.5 million a year.
That's not the sickle cell drug, is it?
The sickle cell drug's about $280,000 per treatment, and
is that the new one? There's a new, more permanent treatment that I think just got approved, Commissioner.
The permanent treatment's in there, but you got to take it 4 times.
Okay, I got
so it ends up right at $1 million.
$1 million.
And we are covering most of that.
Okay.
And you know, we got a different culture from other states, so there's a lot we have to do.
Sure.
And we'll work on it. We worry about how the benefits. You can't increase benefits and keep the rates low, and the state's got to pay for it. And that's a quagmire for me.
Yeah, or the providers absorbing it.
Well, the providers all want more money, and I understand where they're coming from because they've got cost of living inflation, and I don't know what they're going to do. We'll work with them, but you got to bring them to the table. You got to understand the problem before you can solve it.
Feels like COVID stuff just totally upended the healthcare industry.
COVID did so much damage to this nation and to our healthcare systems, and we still don't know what's coming down the pipe from it.
Yeah.
We don't know what the long-term effects are. But
yeah.
Bottom line is, we keep working. I got a great staff,
yep.
in spite of the fact that I get my budget cut occasionally.
Yeah, I understand.
They don't cut my budget. What they do is they cut the number of pens I have, so I can't hire anybody.
So you still got the high-risk pool. You mentioned that earlier. You still got that in place. Well, that's important. I mean, that's
well, we did some things
good thinking there.
I will have to give credit to Tate Reeves for it.
Okay, good
back
planning.
when he was a lieutenant governor, and he probably doesn't remember it. I just casually mentioned, I need your help. We keep the high-risk pool intact.
Yeah.
Instead of letting it go to waste, we may need it one day.
Okay.
He said, if that's what you want, Commissioner, fine.
Okay.
So,
well, that's good.
And we got money. We were going to use that money that's in that risk pool. It can't be spent for anything except health care.
Okay.
To start up the exchange, and that didn't happen. So we got a basis. Does that make sense?
Yeah,
Gerard?
sure, absolutely.
To try to help people on health care.
You're also the state fire marshal. Tell us what's going on there. Any updates?
State fire marshal, we got $18 million more of recurring expense, which we've been trying to get for 10 years, to give to the cities and counties for fire protection.
Okay.
That's a big deal because that keeps your rates low on your homes. It helps the cities and counties not to have another rate increase in taxes, and it's a win-win for everybody.
Yeah. Well,
and I will admit I'm tempted not to give some of that money to the cities where you got a rep or a senator that voted against my fire bills. Now, that's punitive, and I'm not going to do that. But, buddy, I want y'all to hear me say that.
Yeah, it doesn't make any sense.
They think,
totally agree.
You can't do anything about it, Commissioner, because you don't have a vote, and we control the purse string. I said, well, there's other ways to do that.
That's interesting. A lot of folks are also noting that their homeowners insurance, umbrella coverage, et cetera, liability coverage is increasing. What are you hearing there?
We're looking at about 8% increase on homeowners for this next year.
Okay.
I announced today at the fair that we've had 1.1 million homeowners and automobile folks that have had a reduction on automobiles.
Okay.
And the reason I say homeowners because they're combined sometimes.
Okay.
Of 1 to 8%. I got a filing Monday from a company that's well known on 120,000 policies to reduce it 3.8.
Okay.
So we're turning the nut.
Well, good. Yeah, that's welcome news.
And it's just the opposite of what was predicted on the Trump's tariffs. They say, well, the tariffs, everything going to go up.
Yeah.
It's had the opposite effect. It's gone down.
Yeah, I mean, I think we're still a bit early in that process. We'll see. But so far, certainly all the prognostications of doom and gloom were totally wrong at this point, is what we know. Yeah. So, all right. Commissioner Mike Chaney, he runs the Mississippi Insurance Department here in Mississippi. We appreciate you coming on, Commissioner.
Always a pleasure, my friend.
Yes,
Take
sir.
care.
We're